FM Radio 96.7, 96.7 FM Radio Iligan.
Lagi ka pinapakinggan kahit saan, kailanman. My favorite music radio. Ang pinaka-maaasahan kahit saan, kailanman. My favorite FM radio.
Ang inyong madunggan nga programa iya lamang sa nagdumala ni ining maong tulumanon og dili minugna sa FM radio station. Alang sa mga ginikanan nga adunay anak nga nag-edad 18 anyos paubos. This program is rated SPG. Please be guided accordingly.
Welcome to Healthy Friends. Get ready for healthy living, where we share tips and stories for a healthier, happier you. Stay tuned for wellness insights and expert advice with Doc Cat, only here on 96.7
FM Radio. Favorite music radio. FM Radio.
Good morning, Iligan. Good morning, mga ka-healthy friends. And another Tuesday brought to you by Iligan Medical Society with Friends Radio. A topic na very relevant sa ating tanan. Probably not relevant for some karon, but tanan naman tang girls no moagi is ana na stage na yung menopause stage. Ako, I think nandun na ako sa ingon nila na dapat mag-start na yata yung symptoms ng perimenopausal. Pero I have to admit for someone who is not in that stage yet, there is parang this fear gamay, apprehension, and we have to admit a certain level of vanity ba, 'di ba? Vanity na, oh no. Magmenopause ko, no? And daghang mga dark clouds in our minds, no? For those sa dili pa. But you know what? Of course, naanatay mga role models who've been in that stage, who are in that stage, and they continue to shine in society, just as atong mga guest karon. Isa sa naisip ko, if I could get to the point that they have reached, no, then I think meron na akong na-tick box na wagi in my life, no? If I could be as radiant and as sexy as our OB-GYN guest today, Dr. Gemma Serrano. And if I can maintain the enthusiasm, no? And pagiging hyper and pagiging flexible of Ma'am Connie Lo Noval, wagi na ako sa buhay. No? So, kindly greet our guests, Dr. Gemma and Ma'am Connie.
Good morning, Kat. Good morning, Connie. And good morning, Iligan. Good morning to our listeners.
Okay.
Thank you for having me here, Kat.
Second time ni Doc Gemma. Si Ma'am Connie, matagal ko nang iniisipan at some point in this show, need jud siya na adiri. Kasi very inspiring, no, the positive attitude, no, the glowing persona, and then makita mo pa siyang nagsisplits online. No, so di ba, Ma'am Connie?
Well, sometimes I do. I shock everyone.
No, yung pala, I can't even reach my toes sa age na ko. Pero no, we're talking about menopause, no? And this is something na parang for people my age, parang as much as possible, i-delay natin tong usapan na to. This is not something you talk about amongst your peers,
yeah.
no? Oo. And kahit nga pag perimenopause ka na, parang hindi mo pa rin pag-uusapan, no? This is something that you hide. So, Doc Gemma, can you define for us what is menopause ba?
Okay. It's a natural stage that we women, all of us pass through, no? Nobody is spared. It is something permanent, meaning dili siya mobalik, no? And it is the end of our reproductive life. So dili na ta makaanak when we go to or into menopause.
Okay.
And it is the stage where it's not just not having menstruation. No? We have to have no menstruation for 12 consecutive months.
To
for,
say na.
for us to say that we
It's
already are
menopause.
into menopause.
Okay. So, positive note, nakatipid ta sa napkin.
Yes.
That's what I was thinking.
No, positive note, nakatipid ta sa napkin. But what is the usual age ang pagtungtong sa menopause?
It ranges from 45 to 55. But
Okay.
for us, Filipinos, it's 48. Oo.
Okay.
Though
So,
Americans, sa ila is 51.
ala, ba't
Younger
na-
for us.
Bakit tayo younger?
Ang Asian daw is younger.
Ikaw, Ma'am Connie, what age did you reach it?
You know, I was thinking about it a while ago. Sabi ko, kailan nga? It started 53 for me.
Oh.
It's late. No?
It's 53 and then by 55 doon na talagang nag-stop. And I'm now going 65. So, but honestly, when some people are saying that they were parang may ano sila to have that menopause, para sa akon parang I was looking forward to it kay you know, I don't know if the others are the same as me. When I bleed, I really bleed a lot.
Ah,
So it was really parang ano din for me.
a relief.
Yeah, a relief for me. Anyway, I had 3 kids na. I was happy with the
Oo.
3 kids. So, and I know naman nga it's not safe also, di ba? Kapag ano, if you're older and to be having that and then to have kids. So, para sa akin, it was okay. I did my part already having 3 kids. I mean, I look forward to, it's a negative thing for some women, but I looked for a positive way of thinking naman. Like, as you said, wala na napkin, di ka naman yung budget para sa napkin monthly. And yung, ano ko, yung, I get, parang ano dito, get nervous about the inconvenience of having that yung every month nga I get with the heavy bleeding.
And you go
Kung
hormonal.
yeah. But you know what, before I stopped, I really had, if I'm a heavy bleeder, mas heavy talaga when I started with my
Yung padulong na
Yes.
going
It's
there.
usually the case. Before menstruation really stops, you go through months of having irregular menstruation. And
Yes.
usually it's, as you said, it's profuse
Yes.
and
Nag-final
prolonged.
hurrah.
Oo.
Mas profuse siya. Sometimes meron, sometimes wala, sometimes konti, pero bumabawi after. That's how I
Pero parang
Experience.
medyo mas scary ka, no?
Yes.
Dahil sa ganun ka-irregular, then biglang madami, di ba?
yeah.
Yes.
Pero ba't ganun, Doc, no? 48 to 55, and Ma'am Connie here had her menopause at around 53. What affects yan, yung variability natin?
It's really hereditary.
So yung mom mo medyo late din.
So,
Yes.
kung ano yung age ng mother mo that she had her menopause would probably be also the age that you'll have your menopause.
Okay. Other than that, wala naman, like, does our lifestyle or certain conditions in our body affect
Yes.
also?
Other causes of early menopause would be surgical, no? When your ovaries are removed surgically, or you undergo chemotherapy for malignancies or radiation, or there are really persons who have premature ovarian insufficiency, meaning when you say premature menopause, it's before the age of 40.
Pero it doesn't mean, halimbawa, kung sa'yo ako nag-start magregla, sa'yo din siya. Or, hindi din.
That's the myth, no, that if you menstruate early, you'll have your menopause early also. But no, it's really hereditary.
Okay. Sige. Pero segue ko lang yung regarding sa pag-start ng regla. Naana ko yung ma-encounter na very young nagre-regla because they're yung mga kids ngayon na obese or magsulti na
I had my, I don't know if that's
No.
early, Doc, 9 years old.
early puberty would be 8.
Yeah.
The
Mga
cutoff
8
is
na.
8. We don't
Okay.
want an early
Yeah.
puberty because you'll not grow after you'll not grow that that fast already. If
parang
you already have
hinay na
your-
siya, yung imong growth potential.
Mag-close naman ang epiphysis.
Oh, okay. So yun, yung when you started your mens doesn't really affect yung age mo at menopause.
Usually we
Okay.
have our menarche at 10 to 12. No? But some, as Connie
Yes,
said,
I was
9
the
siya.
first kasi in my
Oo,
class eh.
The first in your class.
First in your class.
I was the first in my class sa grade
You
elementary.
were also the tallest in your class.
Yes.
Yes.
Before. But now nag-apas ng uban.
Kasi all-girls school ka, ma'am, di ba?
I came from a co-ed school
Co-ed
in
ba?
elementary.
Okay.
Oo. And in fact, I didn't know about menstruation that time eh. So, I
Ako
was
kasi
wondering what was
all-girls school, me. So, kung nadungog kang may classmate ka nagsugod na,
Oo.
you're all curious.
Oo.
How was it?
So usually it's the tallest girl.
It's
in
the
the
tallest
class.
girl.
It's the biggest
Yun
girl
pala.
who has her first.
But when I was in high school, I was in an all-girl school na I still stay in the line sa tallest kasi nasanay ako, pero I'm really the small one.
Okay. Naku, so ano na pala yan, no? Duol-duol na yung aking little girl to be not so little anymore.
Oh, dalaga na.
So, ano, Doc Gemma, ang symptoms usually of... Sige, start ko muna. Yung sa aking age, yung padulong, yung peri.
The perimenopausal period. Depende man yun siya. Pero usually, it's the most prominent symptom would be the hot flashes.
Okay.
Night sweats. Then what comes with night sweats is you could not sleep, so you'll have insomnia. When you wake up, you're irritable, you have mood swings. So it's kind of kanang urang mo cascade na siya, no? So
Sa amin kasi sa IM night sweats, baka may TB ka. So, pwede perimenopausal lang po.
then you'll have vaginal dryness, painful sex. You'll have also urinary symptoms. You could no longer control your bladder. No?
Oh my
You'll have
God, oo.
incontinence.
So, yan ang mga those are the symptoms to look
And what
forward
is really
to.
we don't want is the osteoporosis because it could lead to fractures.
Okay.
Yeah.
Pero yun, ma'am, no, it's very, the symptoms that I think for me, medyo mabigat here for women and also probably husbands would need to understand is yung parang yung psychological aspect. Yun nga yung sabi nyo, yung irritability, the mood swings, the decrease in, libido and the
Yes.
sexual desires ng woman. Parang yun yung isang the husband need to also understand these things. And meron bang umaabot sa point na talagang uncontrollable yung psychological aspect na yan, no? Na para
Yes,
siguro
usually women would come to us complaining of the dryness. And they could no longer have that intimacy with their husband.
Okay.
So there are certain ways that we could address that. Especially if it really affects the relationship. We could start them on if they we usually start because I'm into lifestyle medicine, so I really advise them first to go into lifestyle changes.
Okay. So
Like your diet, don't get too fat kaya it could also affect your
Yes.
diba?
Yeah. How you feel about yourself.
Yes,
Oo.
oo.
the
Your
self-esteem,
confidence,
feeling ko
oo.
self-esteem ang isang key dyan, Ma'am
Yes,
Connie,
yes,
no?
Yes, diba? You'll develop cortisol belly.
Yeah.
So,
That is why fitness is
Yun
important.
nga. Kaya yun nga yung gusto ko kay Ma'am Connie din dito eh. Kasi
we
yun
could address,
din.
really
oo.
address that. And there are also medications, no? We could advise them to go into hormonal replacement therapy.
Okay, no. So parang siya yun. It's a very for me siguro the symptoms we can the physical symptoms we can justify. Pero yung psychological part,
Yes,
yun yung
the
mahirap
mental-
hanapin, yung mental health part, no? So ikaw, Ma'am Connie, did you have to go through all these things then as
I went through with the heat, no? I really feel it from my shoulder. Ang drawing at that time, the drawing I saw was from the shoulder all the way up.
Yes.
And it's really true. From the shoulder all the way up, parang may smoke. And when I put my eyeglasses here, I can see the mist. Because talagang I felt hot. But since I'm in fitness, I'm always hot. Like, I'm always sweating.
Oo.
So, I'm used to sweat. So, parang it was nothing uncomfortable or new to me because I was really always sweating because of my work. And then, ang ano pa, well, siguro nag-ready jud ko. Parang gi-accept ko na jud na magtiguang na jud. I just accept it, you know, it's coming. So, I might as well find ways how to go over it. So that's it. As what doctor said, you really get bigger because your metabolism also gets slower, and still you eat the same way. So again, it's really as the doctor said, nga, it's really the food that you eat, and also life changing, which is part of it is really to really work out, is to really, which I was doing already. Kaya I had no problem with it. And then the dryness, yes, I did experience it, but I had to find ways how to do it. Because my stamina is still there.
Yeah, find ways, good.
Yeah. Well, there are ways, no? If you really want to make your husband happy, you really have to find ways, di ba? Hindi ka maghulat. It's you who have to find ways. So I found some
Kasi
ways.
unfortunately sila, hindi nila sabayan yung cycle na, yung ating ano, no? Yung
The
ating
andropause.
hormone, yung hormone, natin, cycles natin. Sila, it's always there, no?
Yeah.
Parang bihira lang sa kanila ang nagtalagang andropause. Sila, they're always there. Kaya, yeah. And actually, ako, I encounter it talaga sa clinic ko. Both male and female patients who find it, kahit nasabihin mong senior citizens, 70s, ganyan, who really ask you on how to maintain yung kanilang intimacy with their spouse.
The first thing there, I think, Doc, it's the stamina.
Oo.
Because some women, parang syempre, they're doing a lot of things in the house or coming from work, then in the house. So, the energy of doing it by the
Goes
time.
down during the night.
Yes.
Pero
That
I
is
think
true.
physical activity could still help. No?
Exactly.
It's
Oo.
not really your normal household work or your office work. No?
Yes.
You still have to go into other forms of exercise.
That is true.
Yeah.
That is true. I really agree with that. So, that's what I'm saying. The stamina. Because if yan nga nagtanong ako if okay lang to, but if the stamina, if your husband is still wanted, you know, so ang stamina mo talaga as a woman dapat it, you know,
Can
you
also
can
match.
exactly. And as the doctor said, there is dryness. There is. There is a solution to that, you know, the dryness. So, yeah, the doctor can tell you what.
Concerning physical activity.
Oh.
So, because Ma'am Connie is into exercise and all those, we really advise at least 150 minutes. It's still 150 minutes of
150 minutes.
moderate aerobic exercise. And you also put in the week at least 2 strengthening exercises.
Yes.
Yung for these symptoms, again, Doc Gemma, sa dietary aspect, anong diet ang mas sinasabi ninyo sa mga menopause patients natin? Kasi nga, of course, the physical activity and then yung kind of diet that they should be maintaining.
It's still the plant-based whole food diet.
Oo. Because of course, when you're menopause, di ba, sa amin kasi, sa internal medicine is, ang babae, ang baba ng risk niyan for cardiac problems, ganyan-ganyan. Lahat ng census for cardiac problems all goes to the males until it levels up when menopause starts.
Yes.
Pumantay ka na sa risk ng heart problems, strokes as your male counterpart. So, yun
I
nga.
forgot to talk about the cardiovascular
No.
risk. Because during menopause, when you have already low or absent estrogen in your body, then your LDL goes up. No? There is deposit of plaques, so you'll have you're prone to cardiovascular problems. So it's still the plant-based whole food diet.
Yeah,
Whole
the right
food.
food to eat. Yeah.
Because also when you go into plant-based diet, you'll have calcium in vegetables, no, that could maybe slow down osteoporosis, and very low in the so-called fats that we don't want.
Okay. Ako, friend ko si plant-based diet kasi kaaway ng nephro ang ang karne. It increases your risk for yung creatinine blood test mo will really go up. So yeah. And also protein. They think wala kang protein when you do plant-based, but actually you
Yes, we
you
have
do.
protein in a plant-based diet. There is still, the protein would be sufficient for your daily need.
How about yung mga natin? Yung mga aches, bone aches.
Joints.
Joint.
Yeah, usually mang question.
Oo. No, it also arises na rin. It's
Yes.
part na nagsistiffen na rin, no? Mga tendons natin.
So we have to go not just into aerobic exercises. You should have flexibility
Yes.
exercises and balance exercises.
Yes. That is what talaga I'm training also for my students. So that's what I'm always saying also in my social media. Na in any exercise there is flexibility, strength, endurance. So it's not only like you do cardio. It's not cardio, but you also need to do stretching. You need to do balance because as we get older, wala rin yung balance natin. So you have to train your mind and body to maintain that balance and strength as well as flexibility. Yeah. In order to be able to work as you get older. As what you said, yung mga splits in I'm 65 but this year. So that's why I promised myself talaga goal ko din nga you hopefully by the time I reach 70, hopefully it's
You're
if
still
God's
splitting.
will, yeah. I'm still doing the same thing, yes.
Yeah.
Oo.
Tapos, of course, yung issue with osteoporosis, of course, we discuss in diet. Go plant-based, no? And if needed, mag-calcium. Pero yan, kaaway namin pag nasobrahan ng calcium yung kidney stones. Kaya we always say nga, ma'am, even yung vitamin C mo, as a nephrologist, sumegway lang kung konti. Get it from your diet because your tablet vitamin C can cause kidney stones. Then why not get it sa diet? Because diet vitamin C is actually kontra sa kidney.
Yes.
So mga ganon.
Even vitamin D.
Oo.
You don't have to take vitamin D because we are blessed with
The sun.
the sun. No,
And also, in fitness, kailangan sometimes the bone should have impact. To make it strong.
Yung weights mo, ma'am, when we do some of your
Yes.
exercises with the weights,
Yes.
it's not really hardcore weight.
It's not.
Oo,
Oh
but-
yes, si Doki has already with
When I have time sa evening, I log in.
yeah. Maganda kasi like what I'm doing like soul fusion. With that program, everything is there. There is flexibility, balance, strengthening, endurance, everything is there. And it's low impact. At our age, at my age, kailangan talaga low impact. But sometimes also, it needs, kung pwede, as you're still in your 30s, in your 40s, put some impact on the bones that you have. Because people here in the Philippines, ang mga Filipinas kasi, when they reach in their 30s, they don't want to move because they want to be careful. Some, kasi they're getting older, so they don't want to move there. They want to be careful. It's not the case. Dapat you should be more active and put some impact on those bones to make those bones stronger.
Compact, no?
Yeah.
Osteoporosis, kontra osteoporosis ang mga...
Exactly. So that's really the findings now. That's why some people at 40s, they do the jumps, they do the running. That's impact on the bones as well. In the gym, it's still the same thing. There are what they're doing in like in Spartan race or high rocks, ganyan, may mga jumps and everything, lunges, burpees. There are people in their 80s that are doing it. Honestly.
How about the chair yoga?
It's not really
Becoming popular.
it's in Zumba, they call it Zumba Sentao. Nga they do abdominal workout, they do
Sitting down.
Yeah, sitting down. I do that with my parents. Because you can do marches sitting down. In fact, that is being taught to handicapped. No, the one in wheelchair. You know, because they need also to move. So marches, elbow to knees, mga ganyan, side to side, yung ganon yung ginagawa namin for Zumba Sentao. Oo. So, yeah, you can do exercises even in chairs.
Di ba you have Chinese line ba, ma'am? Do you have Chinese line?
Yes.
Di ba they do the what do you call that?
Tai
Tai
Chi.
Chi.
It's slow.
Yeah, oo.
Yeah, oo. It's like, naman. Another thing of that is like capoeira. Capoeira is
Oo.
also one. Very slow movement, and yet it really do the strengthening, the stretch, and the balance. It works. Kasi as we get older, our balance nawawala.
balance.
Yeah. Which is
Actually,
scary.
Yeah, because once an elderly falls,
Exact.
everything goes down na sa status ng health. Kaya yung fall, yung isa sa number one na kailangan alagaan, no?
Yeah.
No? Na
Avoid.
to avoid. Oo.
True.
So,
Falls
yun.
and fractures.
Pero kasi Ma'am Connie, marami sa amin na hindi naman nag-start ng younger age. Do you sometimes have new,
Yes.
na?
Honestly, it's never too late to
Oo.
start. Okay. You do it. The start is really hard. I understand that because, like for first 3 months, if you get through the first 3 months, then you will go all the way. Because starting, if you're inactive and you start, you will feel all the pain everywhere. That's when
Forming the habit.
Yes. It's the muscles telling you, na-shock yung muscles. Ano ginagawa natin ngayon? So, that's what I tell my students. If you get through 3 months, maski 3 times a week, okay ka na. I'm sure you will feel how your body feels.
And you'll get addicted. It's addicting, no?
You just feel
Parang
happy,
yun
yes,
nga eh.
with how you feel with your body. Honestly, I even put in my social media, you don't have to be a fashion model in the fashion model size. Just as long as you feel good with yourself and you feel toned, you feel strong, you like that, then you're fine. You can rock your clothes. That's what.
So may pumapasok at their menopause age in your program and you can still accommodate naman no, na okay lang.
Because, well, that's what I'm trying to encourage also to some teachers when they teach. Nga they should teach multi-level. Because sometimes if they see there is a beginner and their class is a little bit higher, so, turn off talaga. Ma-turn off talaga yung beginner. So, it's good nga they are welcomed and then they are taught, for level 1, this is what you do. Level 2, if you want to be, this is what you do. Level 3, if you want to go higher, then go for this. It's like that. So, that's how it should, dapat,
It should be
sana.
taught.
Oo. Dapat they should find a certified instructor talaga.
Ma'am, Doc Gemma, ikaw din sa diet, that's the same. If I'm gonna start, no, because I'm a menopause person and you advised me to do the diet na hindi naman ko anad sa ana. All my life pre-menopause, I've been eating all lahat ng masasarap.
Actually, di ba, food panda naman tayo. Or food panda or grab, food grab, no? There are already restaurants who are catering into veggies.
Yeah. I do that actually. If I think this week, parang malabo na makaprepare ko, i-order na namin. Ahead, di ba, for a week?
Yes.
Ahead na yan, oo.
You could have, because for me, it's 2 meals a day would be enough. You'll have your breakfast at maybe 9 and your lunch and dinner at early, no? Siguro 4 o'clock or before 6.
Then
that would be enough.
How do they feel? How do you feel, for example, no, with all these symptoms? Then you start in this diet. It makes your body feel good din talaga.
Maybe because you'll start losing weight and you'll look better in your clothes.
And it's hard first time. I did that, yeah. Because I'm really a foodie person. I love food. No. So, I did the intermittent. That's what, intermittent
It's not
ba
really
siya?
intermittent. We just cut down on the food you eat.
Okay. Because I did the intermittent. Now I'm doing the intermittent. I eat my breakfast, the right food
Time,
talaga.
the right time.
Yeah, 6 o'clock in the
6
morning.
o'clock.
Yeah, I eat my breakfast, which is like the granolas, the ganyan, and I put fruits, ganyan. I try to make it as healthy as possible. As kailangan kasi yung sometimes if it's really healthy yung taste kasi doon nag-ano yung mga tao eh. So I like there is taste, so the Greek yogurt and fruit, the fruit makes it sweet for me, so ganyan. Then lunchtime. Then after lunch, wala na.
Wow.
Because you're gonna sleep na nighttime eh.
So you'll have 2 meals only.
Yes.
The
breakfast and the lunch. Yes. And if I feel like
Are you counting your calories?
And
No,
pero
I'm not.
You have
You're not.
class pa ba yan, Ma'am Connie, at 6?
Again?
And you have class at 6.
I
You
do.
still feel energized.
Yes, after class, I go to the room na and study whatever I have to do for the next day. Relax, go to sleep. That's it. I go to sleep.
Before sleeping, your last meal should be about 3 hours before that.
you sleep.
So you have a
Okay.
good sleep.
Mm-mm.
Because
Ayun,
even
no?
if you are into menopause, you still need the 7 to 9 hours.
Ayun pala, sleep,
Oo.
no? Ang
Yes,
kinocomplain.
oo.
Yeah.
Oo.
Because there is insomnia, no? So it's still 7 to 9 hours. It's not because I'm menopause naman ko, I just need 4 hours of sleep. It's not that, no?
True.
Restorative sleep is still 7 to 9 hours.
Okay. And then, yun nga, your last meal should be around, sabihin natin mga 4, no? Mga 3.
Yeah, 3 hours
Before you sleep. Oo.
Exercise should be about siguro 2 hours before sleeping.
Mm-mm.
And no longer into gadgets.
Oo.
No? Before you sleep. Siguro more than an hour na lang siguro.
After exercise, you want to sleep na talaga.
So, tama yun. So, tama pala yun talaga na 6 p.m. ang
so
class
to
mo kay Ma'am
battle
Connie.
insomnia. No?
Yes.
Okay,
Yes.
insomnia is really a problem.
Yeah. Yeah.
For those na, sige, who really cannot deal with the symptoms, no? Medically, do we assist them also?
We could assist them by those who are having the moderate to severe symptoms of menopause. We could offer them hormonal replacement therapy.
Okay.
Yes.
For those na.
But we have to screen them because hormonal replacement therapy contains estrogen and progesterone.
Okay. Which will make you at risk, no?
Yes.
For
If you have a history of estrogen-dependent cancers like cancer of the breast, the endometrium, history of stroke, liver problems, then we don't advise hormonal replacement therapy for you.
okay. So no? So if you really cannot handle the symptoms, of course, we always start in any kind, although this is not a disease, but if you're going to look at yung mga medical guidelines, it always really starts with lifestyle change, no?
Yes.
For diet and also especially, no, kay Ma'am Connie, yung physical, yung kumota ka sa yung physical activity for the week. Then, of course, no, if you need yung psychological aspect, but it follows when you have the right diet and if you have the physical activity, it follows the
Yes.
psychological, no?
I think it's more of accepting it. I mean, it will come. No matter what, it will not stop. It's there. It will come to you. It's just a matter of accepting it. And siguro maghanap ka jud yung mangita ka jud kung ano pwede mo mahimo ba. Yung you don't stay in one place. You have to look forward to do something else.
And both of you are very social, I know. You have a lot of
Yes,
friends.
social connectivity is also
Yeah, that's one important thing. You have your friends that you can go out with, you can talk with. And also, I think with me kasi, with the personality, if there's any negative, I try to find what is positive. So, usually sa tao yan eh. So, you just don't, like, deal with self-pity or you just stay in one place, you know. I would suggest they look forward to what they're gonna do the next day or what they will do now. And one of that's it, yung physical activity. Because when you're doing your workout, you form friends, ganon. Kick out all the negative thoughts.
Especially yung COVID, ang hirap nun.
Yes.
Hirap maging social nung COVID.
That time, we did virtual. That's
Yeah,
why I
we did the
started with
virtual.
Virtual classes.
Maganda yung attendance ko nung COVID time.
Yes.
Because we have to understand that we have to help them in their improving their QOL, the quality of life.
Yes, yes.
We have to, not when they are into menopause, they're still 50 years old. So,
50 years old sa atin ngayon is like,
you're still in the peak of your career,
yes.
no? Maybe principal na ka, you're the head of your office. Then if you won't be able to address your menopause, then it will really affect your, the workplace.
Kaya tumataas na nga, 'di ba? Like the 40s or the new 20s, 50s because gumaganda yung medical natin yung medical management natin
Ang
sa
retirement is
lahat.
still 65. No? So you have 15 years in
Sana nga yung retirement na yan i-assess no? Dahil lahat ng mga sakit ng mga senior citizen lumalabas kapag wala na sila masyadong ginagawa.
Yeah, that's why you have to be really active.
Yeah. I mean, if your work really tells you that, we need to retire because that's policy, we need to shift. We don't really need to retire in general.
That is why I went to virtual also, because I found out there are some people who stay at home. They don't go out so much. Or they go out, but they want to come back home earlier. So those are the people but how can they work out if it's like that? So that's where is my market is sa virtual. So yun, kung kinsa man ang gusto maging fit but they are at home, they have no time to go out, then virtual is really one
And you don't require a lot of things.
No.
Basically, katawan. Yan lang.
Exactly.
Katawan lang kailangan.
Yes, body weight. Your body weight. No need for the gym.
Yun. So, basically, all these things, the lifestyle requirements for a menopause, is readily available.
Yes.
And if you need further help, we can go the extra mile for you. Go to your neighborhood friendly. And they are all friendly. Obstetric gynecologists here in Iligan,
Yes,
If may special, but yun nga, still, dili ta pwede magbuot-buot when it comes to medication. So baka naman si kumare nagsulti, uy, itong akong gitake.
Yes.
And it,
especially HRT, no? You have some prerequisites. No? You should undergo mammogram or even just a breast ultrasound and transvaginal ultrasound to check the endometrium before you go into hormonal replacement.
Uy,
It's not just over the counter.
Naka-encounter ko ma'am nung nag-take thrombosis. Nag-blood clot sa akala pumunta sa akin dahil akala edema hupong, but it showed meron siyang deep vein thrombosis, mga ganyan-ganyan.
She was taking HRT.
Yeah, so we need to hindi prescribe, Oo. So we need to do the proper screenings for these medications and follow-ups. Dili ka pwede basta-basta mawala sa radar if all of a sudden if you're taking something
for some women,
medication.
HRT really is the answer, no?
Yeah, especially
dramatic yung nila.
For loss
what they
of
feel.
hair, di ba,
Ayun
Doki?
pala, basa
loss
ko
of
when I
hair.
googled last night, hair loss, no?
Yes,
Oo.
part of menopause.
Actually, it's part
That
of
is
aging.
That is, well,
We have
trying to.
neighborhood-friendly dermatologists also who
Yes.
can help us with that if nata issue sa hair loss.
Yeah. Yeah.
Oh, lahat ng tabang na diri sa Iligan. Lahat ng support, we have it
And
here
for
sa
osteoporosis, we
Iligan.
always also have the Dexam.
Yeah. Have you checked it your bones? Pero I
Yes.
feel your bones are very
They're still okay.
they're very okay.
Still healthy.
Oo. Ako din, my husband, when I reached 40,
Oo.
pinahiga niya ako doon sa Mercy Community Hospital, is the
Para
only one
to
that
check,
has it.
yes.
And chinek niya. But he also checked the other components of my body. You can check that there, your water content, your your fat. And even sa ganito kong katawan, I tell you, ang bati ng aking internal fats.
You're running, di ba? Doc?
Oh, but my visceral fat, baka yung diet siguro, and kulang pa. Like what you said, the metabolism.
Yeah.
I remember running not even as vigorous as I'm doing now at my 20s. And I'm like so, 24, 23, ganyan. And ako, I think I'm running more vigorously and everything, but still, no?
But anyway, na-finish mo.
But still, but yeah, it comes with acceptance. As what we will keep on saying kanina. Acceptance and consistency.
Yes,
Diba?
oo.
Consistency
We have a
with that.
scale for that, parang weighing scale
Oo.
that will tell you your visceral fat and your body fat.
Oo, hindi
Something
lang
like
yung,
that. And-
hindi lang kasi yung
And it will also
nakukulot.
tell you your medical age.
Yeah. Ayun, if you have the Garmin, sana Ma'am Connie, ano kaya ang fitness age mo? Baka it's not your 65.
Yes, it's not the chronological
It's not
age.
your, may ganon.
Okay.
Oh, with my running, I'm turning 40. I'm turning 42 this week. I'm turning 42 this week. Pero ang aking fitness age according to Garmin is 38.
That's the new Garmin siguro.
Oh, yung watch na, yung mga fitness watch, no? It tells you your age na because based on your weight, your logged physical activity, of course, your heart rate, no? The oxygen consumption that your body can take, all in all, fitness age.
Yeah.
And pwede jud kang teenager ka siguro,
No,
Ma'am Connie.
not yet.
Ang 65 mo siguro nasa 20 fitness age jud ka.
But my BP is,
You're not taking
Yeah.
anything.
nothing. In fact, kasi my family has family history of
Hypertension.
and diabetes. So, we're 4 girls. All 3 girls, who are younger than me, have maintenance already. So, I hope, thank God. Not yet. No maintenance
For
yet.
you yet.
Yes.
It's just your diet and
It's
your...
just my vitamins. Yeah. Vitamins. I still, vitamin E, B, A, B, C, all those.
Ayun, since Ma'am Connie mentioned hypertension, can we have a rundown, Doc Gemma? Ano ang mga sakit, no? Mga illnesses na lumalabas sa menopause, yung at risk ang isang woman na menopause na siya?
Cardiovascular. No? So you're more prone to hypertension because it will increase your plaque deposit due to increase in the low density lipoprotein, and you're prone to osteoporosis and fractures. Concerning the urinary tract,
Yes.
you're more prone to infection, no? And incontinence. Actually, when you go into menopause, then a lot of medical conditions will come in, no? And even the insomnia, the lack of sleep could trigger in mental problems. So not just physical but also mental.
Kaya dinescribe nga natin the kind of lifestyle that we need to adhere to during this stage, no, the menopause stage. Na we can counter again, cardiovascular is something you counter with lifestyle change, no, physical activity and diet. Also the insomnia, no, almost majority of that is lifestyle related, no, that can be
Yes,
managed by lifestyle.
Yes.
Siguro pag pumasok ka ng menopause, you need to have that mindset lang na you need to be more adherent to these lifestyle
They don't stay in one place. That's all I can say. And you know, you feel sorry for yourself that you're getting old. You should not. You should look forward what you can do while you're getting older. I think that's the way to kasi if others kasi don't think that way, then they will always stay in that place, self-pity, feeling bad about themselves, they don't look good. Mga ganyan. It shouldn't be that way. You should look out, look forward, and try, as I said, invest in yourself. They should invest in themselves talaga. And always go to your OB-GYN. for yearly check-up, importante yun talaga.
Kasi again, even the malignancy, cancer risks will start to catch up on you when you reach menopause, di ba?
Yes.
Oo. But still, you know what, girls, tayo pa rin ang mas mahabang lifespan kaysa sa boys. Kaya when we reach menopause, let's not feel sorry dahil ang haba pa ng buhay natin after that.
True.
It's usually the husband goes first.
Or baka si husband ang na-depress, hindi naman.
Basta stay active lang sila. And never think that you're old. Look, never talaga. Because some people are asking me, how come I don't look my age? I said, it's because I don't feel my age. I still feel like because it's probably working with young people. Because I work with young people. Kaya okay yung mga teachers because they work with young people, no? So try to work with them and get to know what you can do in the future or the next day.
Kasi ang
looking forward.
naririnig mo madalas sa mga tao, they make age an excuse, no? Ay, dili lang sad ko. Kasi naman
kasi
ako.
tiguang na ko. Di ko kaya na. There is di ko kaya. The di ko kaya, I don't believe in that. Because kaya mo na if you really want to. Yeah. Even in anything that they do. Like, I have some people coming to me, Ma'am, anong exercise pwede sa tiguang? And then I would say, may I know how old are you? And then 53 is tiguang for them. And I said, that time when somebody asked me that question, I said, Ma'am, 58 na biya ko. Kita mo tong gasayaw tinto, 60 na biya na siya. So, it's how you feel. How you feel for yourself talaga. Yeah.
Even your cardiologist, your friendly neighborhood cardiologist will not even say, oh, you're post-heart attack, don't move, ha? They will not actually say that, no? They actually encourage, of course, by gradients, but the goal is to get back.
Yes.
The goal isn't like to keep you in one corner scared.
Oo, and inactive.
Oh, no?
Yes.
So I've never heard sa mga guests natin diri na nagsulti na, uy, naamoy back pain, magpuyo ra mo. Uy, naamoy, walay doctor diri nagsulti ng ana. It's all about keep yourself up, active, get back to the most normal that you can be, no?
Yeah.
Yung mga advice ko sa gara.
Anywhere they go for exercise, they should always tell their instructor. That's why I have, usually I ask for history, the history, no? Like if they have problems with their back, problems with their joints, problems kung ano man sa ilang body, so that the teacher would know how to handle them when they're working out. Kasi you cannot work out the same way as a person who has no problem. It's different.
Okay. Ito, ma'am, this is something I would ask naman for those not on menopause. How should we be preparing for our menopause? Kaming mga dili pa. What kind of life na so that we can have like a smooth transition into it? Oh.
Because it's the transition which is difficult. No? Before you really go into menopause, you'll have irregular menstruation. You'll have for those who still do not accept their age, no? So they become threatened, no, by the younger generation, no. You become jealous of the office mate of your husband, the younger females, no. So it should not be like that. No, prepare yourself, no, that as you reach 50, you will nobody is spared of menopause, no. You should be be able to accept that. No? And always stay on the ideal weight.
Ayun, ideal body weight. Ang daming OB-GYN malignancies na weight-related, no?
Yes.
Like the breast, ang
Endometrial cancer.
mga ganyan, no? So, kasi we're talking about telling people this diet when you're menopause, this exercise when you're menopause. But it's good to start it. It wouldn't hurt if you start early.
Dapat
Yes.
much earlier.
Earlier, the better.
Oo, no?
Yes, because once you do it earlier, everything will just come easy for you. Hopefully, yung when menopause comes. Yes, because if you're active, ang lifestyle mo marami socially, emotionally, everything is intact there. For me, that's why I was surprised when people are asking me they get depressed. I'm not saying but it's because probably if you're active, you don't think of being depressed.
There's no room for it.
Exactly. Oo. That you should think about it because you have friends, you go out.
It's the social connectivity. That's
Exactly.
that's one of the pillar of lifestyle medicine. Social
Yes.
connection. And avoidance of risky substances like tobacco smoking, cigarette smoking, because that will worsen the symptoms of menopause. And alcohol. Because alcohol could affect your sleep.
Okay, oo. Yun yung mga vices, no?
Yes.
Vices. Also, a lot of sweets. No? There are a lot of sweets. Parang dito sinasabi namin minsan dito, coffee is good pero oops, ang coffee pala ngayon frap na. No, mga tamis na
yes, it's the cold ones with sugar.
No, hindi na yun the usual how we say coffee.
Coffee or black coffee.
Ang coffee ngayon is na artisan, na tamis na kaayo, no? Mga ganon.
Ang ko lang with food is you can take it basta in moderation.
Yes.
Yes. Like for example, before, as I said, I was a foodie before. I can finish the whole bar of chocolate. But now I only cut it by
Yes.
line. I take it by line. That's it.
For me naman, when I also advise diet, I tell them it's like a trabaho, no? For example lang, Monday to Friday you are working for your health. So if you think that you had a clean Monday to Friday in terms of your diet, your exercise, sige, payagan natin ka
Cheat.
ng konti. Mag-cheat ng Saturday, Sunday. Kasi minsan
Actually, it's not really
Oo.
strictly plant-based.
No.
Yes.
But preferably.
Oo.
Yeah.
Kasi siya, parang it's also part of the na you also need to give them something to look forward to.
Yeah.
Trabaho tayo Monday to Friday, not only the work sa office, but it's like working for your health, your exercises, your diet, no, clean. Saturday, Sunday, sige. Have
But
a
in
meal.
moderation.
In moderation.
In moderation.
Then, balik sa trabaho.
We could always
the next Monday
incorporate
to
naman
Friday.
meat into our
Yes,
diet.
yes.
Ay, holiday sa isang linggo,
Ang
no?
meat daw should only be 10 to 15% of your diet.
Yes. And they're saying actually, for those who really want to go to plant-based, they don't have to fear yung mga vitamin B deficiencies, even
yes.
yung mga protein. If you consult actually the right dietitian, nutritionist, they can give you the proper sagol, no, ng mga vegetables na you get those whole thing.
So when I went into training for lifestyle medicine, I have classmates who are nutritionists, coach, lifestyle coach.
At
Lain-lain nga mga walks of sa profession.
At glowy ang skin nila na Ma'am Connie. Baka yung kusog sa Iba si Ma'am Connie, glowy skin, oh.
No.
Yan ang...
As I said, there is a solution as you get older. Everything's going down, so you put
Share,
your makeup
Connie.
going up.
Share daw your solution. Share your solution.
I explain that, and I explain it to some of the people are asking me. As you get older, kasi everything goes down. Ayan na siya. So, when you put your makeup, it's all going up.
Gravity is your
Gravity is your enemy.
Yes. That's it. But I
Everything
accept
sucks.
it. Without the makeup, you will see the lines and everything. It's there. It's there. I accept that. So kaya lang, kapag kailangan social being, there you go. Put all those things that you can,
And regardless of the lines, in love naman sa'yo si Doc.
Oh, yes.
You can see sa very affectionate talaga si Doc. Makita mo dito si Doc, formal, no? Hindi mo matitinag, no? Pero pag
Quiet.
Oo, quiet. Pag lumapit kay Ma'am Connie, parang bigla nag-melt.
Kaya I have to keep my stamina.
So, yun din. So, mga husbands, ang laki ng support ninyo, no? Sa mga ganitong, sa mga
Yes,
ganitong
yes.
stages of your wives' lives. No? Also, your awareness, they will go through this. She will enter menopause. They will have these symptoms, especially the psychological ones,
Yes.
and they need all the help that they can get from
And
the
understanding.
house.
And don't be offended if we refer you to a psychiatrist.
Yes,
no?
oo. Ayun, oo.
It's not you have really psychosis,
Oo.
but a psychiatrist could help you.
Process the situation.
process.
Oo.
They might even give you antidepressants. That's okay.
Yeah. Oo. May iba kasi they think that if you do that, you're thinking that they're, nabuang na.
Nabuang na.
But no. Some people just really needs more help to process the situation.
Yes.
And that is very much okay. So, okay, no? Sabi ko sa inyo, ang ganda talaga ng topic na to. And we have reached the last minute of this hour. So, I would like to ask, Ma'am Doc Gemma, any message sa ating mga menopausal women there? Not to pause. Don't pause for menopause.
Yes. Just menotalk. So I want to reiterate the pillars of lifestyle medicine. Though we have discussed the whole food meaning non-processed, plant-based diet, physical activity with Ma'am Connie, restorative sleep, it should be 7 to 9 hours, avoidance of risky substances, avoid tobacco and alcohol, social connectivity, and ano pa yung isa? Sabi ko na ba tayo lahat?
Murag.
The restorative sleep tapos.
Oo.
Social connectivity.
Okay.
No? So be with your friends, with your batchmates, even go into church activities. That could help you in your stress management.
Huwag sila magtago, magpuyo.
Huwag magtago.
Oo, magpuyo lang sa balay. Ma'am Connie.
Yes. With me, since I have experienced it, for me, sa ako lang, if you know it's coming, you cannot stop it. Accept it. And in acceptance, meaning you have to find ways and means to find solution for yourself that will make you happy. So like, if you don't want to, the exercises, some people don't want to go to the gym. So you can do your own walking, kung swimmer ka, swimming, jogging like you, Doki. So, mga ganyan, walking around lang is fine. Dancing is another. So if you want help, then that's the time you go to your gym, to your friendly neighborhood gym, or if you don't want to go to the gym, there is virtual classes that you can attend. Also, don't stay in one place. Always look forward to what you will do. Find an activity, and please don't pity yourself. It's not talaga go out, enjoy yourself, invest in yourself, believe in yourself, be happy with yourself. Yung ganon, you have to, other people kasi think nga it's being selfish. It's not. It's not being selfish. You love yourself. I know nga some women, they think more of their families. But don't forget yourself.
Dapat may self-love.
Yes, dapat
And
may
probably
self-love.
you've reached menopause, that's a signal for self-love na.
Exactly.
You've done what you have to do.
Correct, yes. So now, you concentrate on yourself, yes. Don't think negative, always think positive. There's always a positive in a negative, so think positively, yeah.
So I think this also goes for those who have entered menopause unwillingly, like medications
Yes,
and
that's the sad part because some women are forced into
Into
menopause. surgically, especially surgical menopause, no? As early as 30s, 35, especially when it's due to malignancies.
So it just means na, sige lang,
Yes.
just accept it, and again, focus on investing yourself that early on, no? For
At-
your
Others kasi they feel they're not feminine anymore when you're still a woman. Don't worry about that.
yun yung isa, no?
Yeah.
They think that hindi na.
Hindi na sila
I cannot
girl,
bear, I
hindi na
cannot
sila
bear a
babae
kid.
or something. No. You are still a woman.
Okay, so this is a very inspirational episode. We had this episode 2 years ago with Dr. Heidi Cabildo, and it's a very informative medical info on menopause. It's also a very nice episode. We can post it not to supplement what we have here. But ang kinanindot karon, no, it's very inspirational ang among dating today, no, na this is not just a rundown of unsay symptom, unsay sakit, no? But something na this is gonna happen, but we could actually get to the point that we can be excited and look forward to it, no? So again, thank you sa tanan na naminaw karon, no? Iligan, even outside Iligan. And this episode will be available in Friends Radio page, and you can watch it at your convenience, no? And you can always count on Iligan Medical Society for another health information na makatabang sa ating tanan next Tuesday. So see you!